O lea ia maunga wao pa ia Samoa. Pa ia afua mai le tai sama o le tuimanua se ia pa ia le tai ula o nā whanua o te whātulo watu. Tali tonu o lea o le toi whangvale i o pa ia. A wao Sama whai ngāo Samoa o sa mai le vavau e o lawa i le whavavau. Ai tau ia na o whātulo vale lei le fio atu o le fio ngai le Maputasi, fio ngai le loia sili, le mamalu o taitai o malo, ua tātou whātasi le nei aso, e tui nā tuai le limo le whātalofa. Whātalofa Amerika Samoa, o le fua mai fo i le nei tai au fou, vi ia e pea le alofa maleanga le lei o le atua. Good morning, American Samoa. It is an honor to be with you this morning to provide another edition of information for your understanding on how we, or your government, is responding to the surge of the coronavirus in our community. In today's press conference, we will focus on elaboration on the latest declaration of ongoing public health emergency that was issued this morning by the Honorable Governor Lemanu Deletimaunga. This discussion will be led by the Attorney General, Whainuulelei Utu. Following the Attorney General's presentation, we will have a presentation from our FEMA partners, and then the Department of Health, and then the LBJ Medical Center will conclude our discussion this morning. As always, after these presentations, we will give an opportunity to our media partners to ask questions. And then we will close, as usual, by a special remarks from our distinguished Paramount Chief, Maungatasi Asuenga. You will hear today, American Samoa, a new declaration of ongoing public health emergency, which will reflect a couple of things. The first thing that you will notice is there will be a shift of strategy. We are shifting from a COVID-0 strategy to a COVID-safe strategy. Under COVID-0, the old strategy that we have successfully executed for the last 2 years, from February of 2020 to February of 2022, we succeeded in eliminating COVID from entering and spreading into our community. But since February 21, we now know that COVID is here and it is surging in our community. And we must adjust and pivot to address the unique needs of our community as a result of community spread. We need to move away from mass and indiscriminate lockdown policies and focus on adopting realistic and targeted policies to ensure that our people are able to live their lives safely while ensuring that life-saving services are accessible to our public. This shift also acknowledges that the surge we are currently in will eventually slow down and end. It's just a matter of when. If we are good at getting vaccinated, masking, social distancing, it is very likely that we will reach the end of this community spread and this surge very quickly. The other aspect of the declaration that you will notice is the shift towards more self-responsibility. Under our COVID-safe strategy, you, the people of American Samoa, must take on more responsibility for securing your well-being and the safety of your family, employees, and community. The government will still play a major role in directing our efforts, but it is you, the people of American Samoa, that must take ownership of this cause. You have to take responsibility for your actions. If you are feeling symptoms of COVID, come into the DOH clinic or call 219 and get tested and treated if necessary. If you have not been vaccinated or boosted, please come in and get vaccinated. If you have tested positive, please isolate yourselves. Don't go to work until you are cleared by the DOH. Business owners, you have a responsibility to ensure the safety of your employees and your customers, those who are coming to your store. Make sure that your employees are vaccinated, tested, and treated, and allow them to stay home if they become positive. Make sure that everyone is wearing masks and social distancing is observed. Respectfully, on behalf of Governor Limanu and the leaders of American Samoa, I call on all of our community leaders, church leaders, village leaders, and cultural leaders to please help us to enforce this message to our people. Another major goal of our COVID-safe strategy, as will be reflected in the new declaration and the presentations today, is the goal of reducing the number of fatalities. We want to reduce any fatalities, the number of fatalities to the most minimal cause from COVID. CDC epidemiologists have advised that the high-risk populations for fatalities include our elderly, the immunocompromised, and comorbidities. Again, as our Honorable Governor mentioned yesterday, death is a call made by God and God alone. And we don't know when or how it will come. All that we can do is prepare. So one of the goals of COVID Safe is to push and continue to push vaccination and boosting for our high-risk population, and also to open and to welcome anyone who is feeling ill to come in, get tested, and get treated. At the end of the day, please know that your government, with the great assistance from our federal partners, will continue to do everything that we can to protect our people from possible deaths related to COVID, as has been seen all over the world. We ask and pray that you do your part and join us in this effort by getting vaccinated, boosted, masking and practicing social distancing, and adhering to the health policies as provided by our medical and health professionals. And with that, I turn the floor over to Attorney General Fainu Lele for a discussion of our emergency declaration. Faftai.
O te moai whātulou, pa ia mamalu o tātou watunu. O tau pa ia mamalu wa umon ta oto ao se alo. O mawhoi o na tuu mata manga. Ia e whamanuina pēr le suafa o tātou atua o na o lantau singa alofa i sio tātou watunu. O iei le whātou whala inga le whionga i le kovana ma le kovana lutena. O le ale toi whaonga ina le whailo mumu sama ma le lanmuana. Le ana amata i le lua tausanga taluai. O wā upu to mua o le whailo lanmuana ma le lan sama. Le whātatau i se teimi au le IPC ai tua le whamai o le COVID-19. Talu mai whepuali lua sifuru ma lua. Na iai ro tātou watunu ui le whailo mumu o na o PC ai tua le whamai community spread. Mao le mea moni e le mwhai o na tū mau pēr i tātou i le whailo mumu. Mo le nei tausanga, a wai iai le teimi i le lumanai. Whalai titina ai le numera o tangata PC am tau fia i le whalmai o na o le nei whamai. Mai tau wai ia o na te tala nisi o tapu ma pui puinga. O lea wai iai le tō whā i taitai o le tātou whainga mālo le whionga i kovana ma le lutena kovana. O le whātūlanga ta iala mai e inga whetau i lea teimi ma lea teimi. E tusa ma whautuanga a tātou wali i matama i tai fua mai mai mtanga luenga so i fua malo loina man whan mai. Whapea se whautuanga mai a tātou pāanga mai le malo tele. Polo inga le nei le fionga ko vana I whalavelave whafuasei, tau so I fua maloloina, a mata I le aso lua tae au, mati le aso sfulma lima. O le whaonga ina o talifonga, pei lava na iai mua mua te mi o vai, tangata uma, e ulu fale I so se whaalapu tutonga, so se pisinisi ma fale. Ia e te talaina mo tangata lautele, e te tau na whaonga ina I a talifonga. Ma e te tau na kawai se I tulou I a lau ngutu po le fonga I a Maleisu. O tangata o loo iai I tutonu o tāwale lau pāsese ma pasi lau pāsese, I le temi o loo whaonga ina ai, I lau ina o pāsese, e tau fo I ona iai talifonga. E iai se awanoa lea mo tangata o loo whaamalustino na o ia pe taitoa tasi. E le tau whaia ai e se talifonga. Whapea foi I le teimi o loo iai tutonu o lau taawale ma lau ofisa na o oe. E le tau whaia ai se talifonga. O tatou whatasinga o tangata lautele, ma potuputonga o tangata lautele. O loo whauau le whasaina o potuputonga o tangata lautele, vangana ai, pe a whai se potuputonga I whafo, o le tapulaa e luas fulu tangata, e tau ana whaongaina talifonga whapea ma le vā ia ono futu pe sili atu. A whai tutonu o maota malawa ma whale, ia e te tau ana le sili atu I le sifulu tangata I le potuputonga lea ia ma whaongaina fo I talifonga whapea le vā e tausisia e ono futu pe sili atu. So se teimi e whai ei se potuputonga I tonu o se whale, ia e tau ona lava I le air po le ventilation I to tonu o lea whale. O le alava se potuputonga e sili atu I le whainu mera o tā ua, ia e te tau ona tausangaina I le EOC, numela ono iwa, tolu walu o mo se whaatanganga I se whainu mela o tangata lautele e iai lea potuputonga pe a whai e sili atu I lo numera o tā ua ma ta pulaa o tā ua. O lo whaau pēa le tātou sā ma le vavau, a mata I le iwa I le pō, whaangata I le afa o le whā I le vaveao. Ia mai I le teimi o le vavau, e sā o na ulufafo se isi mai lo na maota ma lo na lawa ma lo na whale. Ia se I vangana ai wa sa ili soani mai I le whale mai, ia po le whale leo leo, ia ma se mafua anga tau. Wa tātou pasi lau pāsese, ma tātou taawale lau pāsese, whātangaina pēa le luas fulwhai tū la ia e wheo iai. Mai te tau ana whaongaina ia talifonga I teimi o ia wheo inga. O tātou whalekesi, ia e mawhai o na whaawau pēa ia latou I tū la masani o lo te talaina ai. O isi pisinisi, vangana pisinisi o le ātāpunia. O isi pisinisi, ia e te tau ona talapea I le 5, I le waweao e tau I le 8, I le pō. O lea ua whaopopo I ei tū la, e te talai I a tātou pisinisi. A iai se pisinisi e manao mia ona te tala I tua atu o le 8 I le pō, e tau foi ona tāusanga ina I le Emergency Operations Center, ia le whātanganga. Ia ona mwhai leo na ilo, ia matanga iai le awhionga I le Lieutenant Kovana. O tātou whale whai ngā luenga, o lo tu mau pēa le fuafuanga, e whātanga I a remote work, ia po o ngā luenga mai le whale, ia ai whaititia ia tangata whai ngā luenga I whale whai ngā luenga. Mai te tau I so sesi o tangata whai ngā luenga, ia ona whātu mauina le vāo le ono futu, le vāo le isi, whapea fo i le wā o tangata o le mamalu o le atunuu o le au fale i lea whalewhainga luenga ma lea whalewhainga luenga. Tau fo'i o na iai le ea pe lava le ventilation i tu tonu o fale o whai iai ngā luenga. Mai tā ua i matanga luenga ma ofisa o le tātou mālo ia o na whautuaina ia le mamalu o le atunuu. Poa ia au nanga ese e ma whai o na whaatino ina i le nei teimi a OPC a le whaamai tua. Au nanga i le interneti, au nanga i telefoni, au nanga i le whalemeli, po le meli, ia whaititia ai le fsotai o tangata in person. O tātou a onga ma polisi, o le whaia ni a onga i in person, ia a le whatangaina ia a onga remotely po online learning. O le tātou whale o whamoemoe i whatua inga whapewhoi le whalmai ia ma le ai ngase o le ātāpunia mō Asia Singa Māsani. Ia o whale ainga, whale tau mafa, e le whatangaina le tau mafa i tono o whale ainga. Whatanga na o le take out, ia po le delivery. O tuai ngā pisinisi nei, e whaasaina o na talaina i le nei fo i vai tau. O pāpia, o bingo, o whale tausi ai tātou whanawiti po child daycare facilities, o whale whamalustino, whale o tiulu, o whale tifanga, ia o sue ngā tupe whai i whafo, ia o whaasaina. A whai ei se isi o pisinisi ia walisi atu. E fia maua se awa noa talaina ai. Ia talosanga i le Emergency Operations Center o no iwa tolu walu o le numero telefoni mo se whatanganga ia e tauana iai se taiala ia e avatu pe au mai le EOC e mawhai o na whaamatalaina ai a inga e whai ai nei fuafuanga i se awala saunga le mū. O le tātou taiala mo le nofo esea ma le nofo puipuia. O le quarantine ma isolation o tangata ia ua mau el whaamai ma i lātou ua lata, close contact, ia ma tangata ia ua mau le whaamai pe nofo whaatasi. O loo tu mau pea le malusianga o le whaatonu o le mtanga luenga o le soifua maloloina, ia whapea fōi le whalmai e ma whai ai o na whaia se polo inga. Ina ia nofo esea ai pe nofo puipuia ia nei tangata. Mai lava i le 5 aso, ia e tau po le 10 i le 2 aso. O taiala mo e olo o malanga mai fafo. Whaalele, whaapea ia waalalo, ma tangata pāsese. O lo tau fia pea le malanga mai Amerika Samoa waalele ma waalalo lau pāsese ma la uta. Wangana ua whatangaina e le fionga i Kovana po le fionga i Lutena Kovana. E ia inga, o lo o whapulatu i le polo inga. Ia e pe ona masani ai, pe a whai e whaatanga ia waalele po o waalalo o na o mai i tātou watunuu. O le isi mta uputa ua o le whaamalu sia pea o tangata ta whai ngā luenga o le tātou mālo ina ia whai tui pui puia ma atoa tui pui puia full vaccination. O iai ma le tō whā ma le whina ngalo o le fionga Kovana ma le Lutena Kovana. E iai tangata whai ngā luenga o le mālo o le a whaamalu sia ai le booster shot. Ia po le tui lon tolu lea o na o le tau mawhai e pui puia ia tangata whai ngā luenga. Whapea fo le mamalu o le atunuu o lo latou tautuaina. Ia mai le nei whaamai. Mawhai o na tingaina ai ia tangata o mamai ai. O tangata ia o healthcare workers, o tangata leo, o e o lo o fuimu, O tangata ia ta o emergency medical technicians, ia whapea fo i tangata whainga luenga o le aito ese i tāwhuna, ia ma le Juvenile Detention Center. O lo o polo ina fo ia le tātou whalmai, ina ia whaia ia inga, ina ia mawhai o na whaamalo sia ai le tui booster. Pau lava tangata e le tau whaia ni tui booster, ia o tangata wa talia ia lato exemption request, ia ona o le tūlanga o lato taltonunga, religious beliefs, ia whapea fo'i ia le medical reason po se tūlanga o le soifua malo loina. E whaangata lea fuafuanga i le aso sfulu tolu o aperila, tolu sfulu aso mai le aso atae ao. Lona winga, whaamole tangata umanei, whaautangia mai le nei whaalinga, tau ona whai le booster shot, e so soani e pui pui ai oe, whaapea ma tangata o le tātou watunu olo o e tautuaina, ia mai tūlanga whaingatā o le nei whaamai, a wawa iai le whaamauninga, o e olo maua ia lato booster shot, e lai titi le awanoa e ulufale ai pe tau fia i whanmai, lai titi fo i le awanoa e tinga ina ai le nei whaamai, pe a whaatusa atu ia i lato wele o iai se booster shot. Tu mau pea ia le tapu lea e saa le price gouging, ma le so na si e pisinisi a lato tau oloa, i le nei fo i vai tau olo o iai tātou i le whalavlave whaafuasei, tau so i fua malo lo ina. Le ngātu fo i lea, wa iai le whaatanganga mo nei fo mai Amerika, ma whai ai o na lato o mai, ia ma lato maua ia le laisene, e whai ai a lato ngā luenga e so soani, whaatino ai ngā luenga alofa mo le tātou atunuu, i le nei fo i vai tau au pisi a tātou le nei whaamai. Ia, o le whamtalanga nā wā le silfia o le tātou atunuu, o le nei ta ia la fou, ina ia mawhai ai o na tātou soifua i au wala saunga le mū, ma le kovitis fuluiva, pe ona sauno atu ai le fionga i le kovana lutena, whaafitai.
Mole atu le ngā whaftai lau fionga i le loia sili, whainu le lei, ia ona o le ngaluenga mai a ea, i le whaamalama la maina, i le paio la tunuu, ia tūlanga foi o le polo inga fōu nofo puipuia o le tātou atunuu. O le temili nei, o le atu lole avanoa, i a tātou sui mai le fima, ia mosa la tōfo i whaasoa mo le silafia le atunuu tūlanga o ngā luenga o lo fia ngai mai la tō. Thank you, Attorney General, for the explanation of the new declaration. And now turn to our FEMA partners, our federal partners, for their presentation on the work that they are doing here in American Samoa.
Hello, Governor, Lieutenant Governor, and the American Samoa community. The government and community leaders, as well as the public efforts have made a big difference, saving lives and avoiding illness. I'm happy to be part of this COVID-19 Omicron response effort with the government leaders over the last week. DOH, LBJ, and TEMCO have been great partners, and the federal family is working shoulder to shoulder with the American Samoa government. We're looking to implement, and we are implementing, best practices from the last 2 years of COVID-19 across the world here in American Samoa. The Omicron variant of COVID-19 has impacted much of the world. COVID-19 has adapted to Omicron, so we have to adapt with it. Some ways that you can help adapt to Omicron is that you can get vaccinated and boosted. Getting boosted is the best way to protect you from developing a severe case of COVID-19. If it's been more than 6 months, come in and get your third vaccination at Pangno Department of Youth and Women Affairs, Tafuna, or Leone. If you develop symptoms of COVID-19, the best thing to do is to get tested and be evaluated for treatment right away. We have had the opportunity to co-locate the test sites and the treatment sites for any of those folks who test positive for COVID-19. American Samoa now has life-saving treatments to fight the virus, but they only work if they're given early, when the symptoms are mild and you're able to get those therapies. So don't wait to get tested, and don't wait till it's too late to get these life-saving therapies. Just to walk you through what the therapies look like, there are two different types of therapies. One is an intravenous therapy, while as the other one is a pill-based therapy. So if you're in need of a therapy because you are COVID positive, you can look at monoclonal antibody sites to include Tafuna, Leone, Amu'uli, and LBJ Hospital. All of us must do our part to stay safe, protect ourselves and those around us, and help those in need. I want to briefly update you on the actions federal support team members have taken in the past few days. 7 of our team members from HHS, CDC, and the Army Corps of Engineers have departed the island on Sunday. That said, they will be remaining in support of American Samoa virtually. We have really appreciated their time here on the island, and we're looking forward to working with them virtually. A 15-person health and medical task force from HHS arrived on Saturday. This team brings 11 medical professionals who are physicians, physician's assistants, nurses, medics, and respiratory therapists. This team will provide 24-hour coverage at LBJ Hospital in 3 shifts, with the primary staff on a day shift when the emergency department is most active. We also continue to have those 29 U.S. Public Health Service commissioned Corps officers augmenting our health professionals here on the ground at 3 vaccination sites and 4 monoclonal antibody sites. Again, I can't reiterate enough the importance of the life-saving treatments to fight this virus, and that if you are COVID positive, please consider getting these treatments early so that you can recover nicely from COVID-19. Our FEMA staff continue to coordinate federal support with American Samoa counterparts, and we are planning for those additional needs to help with federal reimbursement for eligible expenses. It's an honor to be supporting American Samoa during this historic time. Thank you all for doing your part.
Thank you, Allison Flander, for the presentation of the work done by your team, our federal partners, to assisting American Samoa with the surge of COVID here in our community. And now I turn the floor over to Director Mutusa and the Department of Health for their update and briefing.
Atalofa whātalo watu le paia mal mapu o le nei taeao, whio mai whālau whionga le car, le whionga le mapu tas, le malu for task force, Ms. Fo tato federal partners, Ms. Fo le media, and malu tuile manua whātalo watu. Good morning. I am reporting from the headquarters of public health in Tafuna. I am alone up at the conference room, so I'm not wearing a mask. Dr. Laval, our clinical director, and her epi and also surveillance team are down on the first floor. That's where she will report from. And this morning, Public Health is proud to present a overview of what's been happening, transpiring within the past 48 hours throughout the weekend. So without further ado, she will be addressing testing, vaccination, and also treatment in regards to taking care of our people. So without further ado, Dr. Laval, I turn the floor over to you and your team. Over. Dr. Laval, I think you're mute.
Can you hear me?
Yes, we can hear you now. Thank you.
Okay.
Yep.
Atala fatu car, me sit to tino the task force, ape foi malu la tunu, fa fonga mai ni tu la le aso, ona o se ripoti ata mai ama tanga wenga so fo mala loina itu langa o ye nei, e tato su enga, ai me se foi tu pui o COVID. First slide. If I'm Aliaso, I'd like to apologize that we're calling in for this Zoom meeting. None of our cameras are working, so but you'll be able to see the slides. So first slide, Aliaso ana nafi sasi ano fuanga da fayesu so enga COVID tuluiva o le falamaile le LBJ. E se lauli mas full tolu ila so eina ai luas full valu ila so fa maunia o moel fa mai. O numera ia sa ripotia mai ina ua ta fa ia so nafi. So mai le luas full valu ila so moel fa mai e so valu ila so fa pea ona faia ia la so fitinga I vai la au mo le COVID tuluiva. Le foi fa ila no atu la tunu a fa ila wa moa au ngol fa mai yo mai te tonu fa su enga wa leo lo moa ia vai la au a wa tonu fitinga o ila so wa moa COVID tuluiva. Next slide. O ila so umana moa il fa pen fa mai ia moa fa mai na fi e duas fu valu ila so o le so fa ingo ila so wa moa I fa mai tanu na amasaina mai a February e lima se lau lima su mai lima. Mai le lima se lau lima su mai iva so iva ila so fa pea ona recover po o le so moa fa mai. Le lau fa ingo ila so recover e ono su mai solo mai fa se lau iva su mai lua ia active cases po ila so o moa pe fa mai o COVID su mai ko ila to ko ila test positive ile COVID fun maleiva pena sa ua e so avalu ila so na fa pena so fitina ile fa ile I vai la our COVID fun viva o so fa singo ila so o mana fa ila so fitina mo le COVID fun viva e se lau fit fun malima o ila so sa fia fa mai ya la a tu asile la va no ile LPJ ata solen tu fa pena fa sala no ila so sa fia fa mai ile nei vai time ile nei time. Next slide. Ia le asa na alfa fanua peo na iai, le aso an nafi, mai le lusu fai tu la le aso, I no umo tutuila fa peo o lo umo wai, la so po o lo umo wai tanga sa umoa, ile COVID fuluiva, ia peo na tanga ia su fa fanua, ia o iai, ia o moa COVID fuluiva, ile tu malo se sae, ia fa peo fo ina inu ile tu malo sifo. Ale telo ila so o lo umo COVID fuluiva, o fa peo na le tonu o ngā tonu o le tātou atunu, e le o iai ni kei kua I potia mai I manua. Next slide. Next slide. Mo suenga po o no fuanga lo fai suenga ma tonga fitinga o le COVID-19 mo le nei vai aso. Mai le asonga fua e tau le asfarraile. Lo fa apeo na maua suenga, fai suenga ma fai tonga fitinga I leone, fai mai tumalo leone, fa apea foi a mauli, le tumalo a mauli. Pao le suinga o le asfarraile. O le fa apea o na tapunia mai le balu tapunia e tasu. Na ia maua se avanoa o fai ngā luenga, e me te foi e o ftosuani mai e tātou mai Amerika. I fa apea ai o na stand down pe fai sina malo longa, ele I o foi le asto nai, so fai foi si fufuanga na tanga luenga. Next slide. Ya o no fuanga ia lo fai ngā luenga, ele matanga luenga so for malo lo pa apea foi nai ia la so ta o public health officers fa apea na malanga mai le so fao masi. Lo fa apea na mato ngā lue fa asasi I testing site ia e fai suenga ia ma fai tong fitinga o e o maua I COVID-19 maleiva. Next slide. Next slide. Next slide. Next slide. Ia o no fuanga ia la fai suinga o COVID-19 nei vai aso, mai le aso fua tau le asfarraile, o pango diwa, sa funa diwa, o le Leone Catholic Hall, ia fa apea fo ili Catholic Hall. O no fuanga ia lo fa apea na ngā luluele, so fua maloloina, fa apea fo I public health officers, po vai ngal fima, lo mato ngā lue fa atasi. A wale fai ngau tui puia mo le tātou atunu. Le tala sanga atu pe ona tā o pe ona mātou ipotia. E mana au mia lava na fai tu puia e puia ai tātou mai wha mai. Ai me se la tātou o man fai tu e lua, mole e o mai e whaile booster dose wa leo whaamaunia a whailo booster dose e pui ai oi e awene e mai tinga ina pe o mawhai wa ave o whai mai tau fia ono tinga ina ile mai COVID-19 maleiva. O le asonga fuata o le whareile mai le valu le wha, a me le stofi mai le valu le wha, a o le whareile, pa mon more o le valu le tasi. O na wa yel fufuanga matanga luenga, se avisa noa au whainga luenga, ia whaisina malo longa na uli, e o atu e whaira so fufuanga whaataunga pe na iesa so watu. Next slide. O tuinga ina whaila so nai, e lua no fuanga whai tuinga o le makesi whangatongo, a pe fo in malai va lele tafuna. Ia whapea fo ina ia fo i tui o le matanga luenga tawa tui tua i ainga, ina ia whaia ia tui pupu ia o ila tau lo whaata o tolia fo i tono ainga. O le au whainga o tui sa whaia ia ila sto nai, e afe fitus fun ma le lua. Mai le afe fitus fun ma le lua, e iwa se lau wale fuli ma whapea ona whaia le booster po le tui lo na tolu. Lo ia ila wasanga so la tunu lo whapea ona o mai, e whaia le first dose po le second dose o tui inga o COVID-19 fun ma le iwa. Next slide. O se ripoti la samaile la mai manua. Ita o fiti utam fale asao. Sa whai tuinga mo le 5 tausanga, whape first full tausanga e aluanga ilunga. Ma unu meo la to umo whai tuinga I manua ita o fale asao fiti uta. Tolu se lau 5 fun mal tolu. Next slide. O le whaelo atu, I whainga o santo booster dose. O le taimine, na le fast food tolu, testi ma le valu I la to uma na whaile booster dose. O lo to tele lava le o leva o na tawana o mai te tonu e whaile booster dose, e pe fulu ono afe, valu fun ma le tolu. E mana o mia peon whaila ilo atu, e mana o mia lava na o mai tanga tau tato sun, e whaia to tu e booster dose, e pui ai ma le wha ma e COVID-19 ma le iwa, ina ia awena ma I tinga aina, pe a wha pe fuena watu whale mai, e tau fia ai ono ne wha ma e COVID-19 ma le iwa. Mana o mia lava le o mai I fight booster, ai me se foi e o mātutua, tato ama sina mātutua, ina ia pui ai ila to mai le COVID-19 ma le iwa. Next slide. O le tātou pie chart ngā whailoa tuai. E valu tupu mai tasi tesi ma le fitu I la tau wa umana whaia tui puia o le tui mua ma le tui lona lua. Ia, le o minoi tele tātou chart lea. Le tātou tuai le malo le atunu e o mai e whaia tātou tui puia mo le COVID-19 ma le iwa. E valu tupu ono tesi ma le valu pasene o I la tau wa umana whaia le tui mua. So le valu tupu ma le ono tesi ma le valu pasene lea ia e mana o mia to o mai tonu whaile tui lona lua. O le pie chart lea e whaapea o le kawa lea mo le atunu u a toa lava o Amerika Samoa. Next slide. Ia o le atana o whanua wa iei nei, ia tu inga po I la tau po I pasene o I la tau o man whai tui puia I nuu mala la whanga. Ia pēn tō wa ai a tanga I atu. Ua tele a lan moana vai ma le lan moana malos. Ia lo vai atu I manua. Ia, na ua iei lan moana malos I mele tu malo I manua. Next slide. O le se whamasalanga po se ripoti la samailea mai le flight mai le malanga le wain ea na saula se fulu o mati. O lea ua whaapeo na tu ina tu umai la toe o la to ainga e lea so. E lua se la uona se fulu mal whaal pāsese. Whaapeo na so eina mo COVID se fulu mal eiva lea so ana nafi. Ia saule ripoti e negative lava pāsese na o mai le flight lea. Whaapea fo ila uwhenga luenga so fu malo loina. Ua fo ina so eina. Whapea fo on the next le staff for the nursing staff, whapea fo I le vaenga logistics. So whapea na ripoti mai negative le POH staff. Next slide. Next slide. Yeah, o se for the sanga renga so I for malo loina, o la so tu ina tu de sunga whaatonu. O ni from sana whaatai.
Whaatai, thank you, Dr. Laval.
Thank you, Dr. Laval. Thank you, Honorable Carr. We're glad to report that Public Health continue its weekly collaboration with StarKist, and we've already have a approved plan for StarKist to operate under, considering the level 3 that we are about to transfer to or transition to. Things went pretty well during the weekend. They experienced 2 positive cases, and those positive cases were taken care and sent home for isolation. All those cases will fall under the same protocol that everybody else are taken care of. The 2 nurses from Starkey's already been trained, and they are prepared to deliver the test for that staff or that population at the Starkey's. So our next meeting with Starkey's was scheduled for 7 o'clock this coming Thursday for another update. Our Manua plan for the vaccination continues to move forward. We haven't had the opportunity to provide any testing in Manua as of yet, but there's no COVID-19 in Manua. Every person that travels to Manua must receive a negative test and be fully vaccinated before they board the flight. So we do have our lab in Tafuna prepared to test those travelers to Manua from 8 o'clock in the morning to 10 o'clock during the day of the flight. We will also provide a team for Manua to train and certify the staff in Manua for testing and also therapeutic treatment when during the time of need. We do have 1 doctor in Manua, 2 LPN nurses, and 4 CNAs that are covering our 2 healthcare centers in Manua. Travelers from Manua will also have to go under testing when they return from Manua. If anybody gets positive, they will also fall under the same protocol. So we continue to keep an eye on Manua. We continue to test those who are planning to go to Manua and those who are coming from Manua. So that will give us a good idea, our epidemiologists and also our surveillance team, what's going on in Manua. Again, we want to take this opportunity to thank our Federal Public Health Service officers for the great collaboration and being embedded very well with our sites and also our DOH staff. Thanks to Ms. Ellison and also Commander Nomura for bringing the team over and continue to support American Samoa. That's all we have for this time. Honorable Carr, standing by for any question. Thank you. Over.
Whaftaitele lau whionga mo tu sā ma le malu o le tātou ofisa o le soifua malolo ina. Ia o le temi nei o le atu lo le avanoa I le tātou whalemai, le sunga le fomai a Dr. Ledua. Dr. Ledua, it's now your time to present what's the latest and greatest with our hospital LBJ.
Hello, Falava. Good afternoon, the Honorable Governor and Lieutenant Governor, the Honorable High Chief, the members of our federal partners, members of the task force, and the people of our beloved territory. This is the report from LBJ Tropical Medical Center on the reporting on the happenings and the activities that has been going on in your hospital over the last 24 to 48 hours. Over the weekend, we conducted 153 tests to patients who came through our emergency room. Out of that 153 tests, there were 34 positive cases. 34 positive cases, 9 required to be treated and sent home. All of them were sent home except 1 who was admitted yesterday. The admission was a pregnancy-related admission, but because the patient had a positive COVID test, she was admitted to the COVID ward. So the total number of admissions in the hospital over the last 24 hours were 6. 2 of those were already admitted in the COVID ward, and we had 4 new admissions yesterday. 1 of them was a pregnancy-related admission from the emergency room, and the other 3 admissions were patients that were positive, that were tested positive while being admitted in the ward. So those 3, they had mild symptoms only, and they were brought in to be admitted to the COVID ward to be observed over the last 24 hours. They were stable. They did not develop any further symptoms, and these readmissions were discharged back to the designated isolated ward in the medical ward today. The pregnancy-related admission was treated for her condition, and she has already been discharged home. One of the two patients that were admitted in the COVID ward has been stable over the last couple of days, and he was also discharged home today. And all the admissions, all the discharges from the COVID ward, those that are going home, they were given directives as per DOH, and they will be followed up by the Department of Health in their respective homes. As of today, we have had no mortality. There has been no death from COVID-19 in American Samoa. For the support services that we have, we are happy to announce that we received 15 members of our medical community from our partners from FEMA who arrived on Saturday night, and we welcomed them yesterday to our hospital. They were prepared and they got all their logistics done yesterday, and today they have already started work in their respective departments that they are working in. They already been given their schedule, and they will work hand in hand with our existing staff at the LBJ Medical Center to care for our people and also to impart their knowledge and their experience to our staff. As of now, we are also working on getting assistance and help from one of the staffing agency of Ireland. We are in that process, and we will update when we get more information on that process. That is all from us here at LBJ Medical Center. Thank you so much for listening in. Whaftai, Pasoifua.
Thank you, Dr. Ledua, for the update from LBJ on your preparations for the surge and making sure that we have sufficient medical personnel and equipment to serve our people. At this time, we have reached the question portion of our press conference. I have a number of questions that have been sent to me, which I will go through real quick. There is a question on the situation in Manua. The Director of Health has just discussed this, that they have a team to conduct testing that is preparing to go out to Manua. The quarantine in Manua, there is no quarantine in Manua, but anybody who wants to travel to Manua has to receive a negative test from DOH in order to travel. So that's the situation. We had a team out there to conduct vaccination, and I understand that team was only in Ta'u, and so the Department of Health will make appropriate arrangements to have vaccination teams in Ofu and Olusenga as well. There is a question about StarKiss and why StarKiss are being required to get boosters. This is an agreement between the Department of Health and the company of StarKiss. StarKiss makes its own decision on requirements for its employees, and so if StarKiss wants to require employees to get boosters, that would be something that they will have to do on their own. We support it, especially since these employees will be working together closely in enclosed areas. So it's been highly recommended by our CDC doctors that we encourage StarKiss employees to get boosters. StarKiss has been monitored weekly by the Department of Health, and they have weekly meetings to make sure that the situation there is under control. Inter-Samoa travel to the independent state of Samoa, we are hoping to start air travel to Samoa and from Samoa in the next month. So in April, we hope to get that going. The Lady Naomi is able to travel to American Samoa and transport goods from American Samoa to Samoa. Lady Naomi is treated just like any other container ship that comes to American Samoa. And as long as they meet those requirements, they will be allowed to travel. The Hawaiian Airlines quarantine protocols, it is the plan of the task force to move away from supervised quarantine and allow folks to be quarantined at their homes. We are finalizing the plans on how that is going to be done. As you all know, the next flight is March 31st. So the task force and our team members will be working together with the Department of Health and our federal partners to make sure that the policies that we put in place will protect our people. Okay, with that, I will open the floor now to our media partners for your questions.
Lieutenant Governor, la te motuela KVZK on ape le te fasidi anisi. Ola fasidi fa mole fa ftaira na watali mai ia nisi fasidi fa tatawi manua. Ona lena a mai le fasidi mai nai motusa fa mole po afe o toili nisi aki o le COVID o manua ia fa ftaira na watali mai le le vaenga le na o fasidi mo mua o le fasidi fa mole anga I tonu le vaenga o le office le malo o le vai atu na fa testi mai le office leo o le fasidi fa mole pe ese mai business e na fa sala vo e le ustai o le tato tapu pe na inisi o soltu la fono no fa mawina le vai taimi le nei o tapu dia le tato curfew foi le mai le iva le afol fa le tai au fa mole pa ftai lava
Ja, whaftaimul sili Yesu sui o tato ofisa o leo. Mwhaiona talia le sili al KVZK.
Yala, kai mo le bongole, sungole, gar. Ele kele ni soli kula pongo pa malusia le kakumkanga duenga. Kele o enforcement yang paye pa kaunga ile I kavale. Kele langa wono kavale le po koe uska ia le kapo curfew. Kele o isi o enforcement slash pai ma warnings slash pai o kanga ngai pai la ko mask. E ko isu suenga masalo pe isu suenga le price gouging. That will refer ko this case I dungole. Lungo officer lo ia this case wo mga handle ele substation mai leongi which ole susuanga lang pa I ponga it was just a different product is el kau ole kulanga nga se li poki oko mai le game kanga duenga paptai
yeah fa ftai lava
Lieutenant Governor Fatmulmole, good morning. Philly from Samoa News. I just have a follow-up question, please, on the issue of the proposed quarantine for Hawaiian Air flights, in which you stated plans to have the passengers quarantine at home. Is there a reason why the task force decided on this route?
Thank you, Philly. The reason that we are exploring home quarantine is because the COVID is already here in the community. And so, you know, this is part of the COVID safe model that we're looking at, is to allow people to travel and behave responsibly if you are traveling from off island. We also have these people, our travelers are tested twice, and so we are monitoring them before they even board the flight. And so we're finalizing the procedures, but most likely there will be some tests done when they arrive, and after that test, they will be released to home quarantine for a number of days, and then we will proceed from there.
All due respect, Lieutenant Governor, you said people to behave. Are they going to behave?
Thank you, Philly. This is
I mean, really, you're talking about Samoans that don't behave most of the time.
Thank you, Philly. We are putting the responsibility on our people to do the right thing. And the question is, do we think that people in Samoa can do this? Absolutely, absolutely. We have the responsibility to do this, and we must. Turn the floor over to Dr. Saleapanga for more explanation.
Filia e vavai ngaka ia fai mlanga mai vavo. Le na lo mlanga le o manga release nei ya. Mlanga foi la le la sau. Makua le pre-travel e lua complete fully vaccinated. Ia ma negative test e lua. Longa nga ka ngai e farka ngaka. E se fea ko le group le sa mai fafo. E lo le kumua ka ko le wa sa ele. O le whaiunga la le whiunga le car, ma le task force. Kua sao le. O ngaka piko sini se whia le la kaunga mai ka koulo. Ka kou ia. Awa pe koe posit ngaka lea mai whau. O ka kou le ua. O le wea ai, ele o la kou. Papo paku le kali le. Sunga le.
Thank you, Doctor. That's a good one. Thank you very much. Manvia lava le aso.
Whaftai Philly.
Aloha, this is Joey Cummings from KHJ News.
Hello, Joey.
Hi. We're into the third week of a partial lockdown for some of our businesses. Is the government considering any assistance for workers of the non-essential businesses that have remained closed under the emergency declaration?
Thank you, Joey. As you note in the new declaration, we are not using the distinction of essential and non-essential anymore, except for those specific businesses that we are asking to hold off opening until an appropriate time. And even for those who we're asking not to open, we are giving them the opportunity to approach the task force and provide us with a plan that will allow them to operate and be able to provide for their employees and their families. In terms of a new government stimulus to help our businesses, in addition to the food coupons that are provided by the DOE and the tax returns and all of the other benefits that we're providing in terms of food stamp, and food for our elderly through TAWA, the answer is no.
Thank you. Regarding ASG vaccination requirements, can you give an update on vaccination rates for ASG employees?
I just received this morning a report from the Director of Human Resources, and I'm not sure if she's available today, but the report states that 95% of all ASG employees are now fully vaccinated. There's been a request for 59 for exemptions, and I am not, the report that I have doesn't say whether those requests for exemption have been granted.
So do you have any information specifically about numbers of people that have been suspended until they meet those requirements? And is there a next step for those who persist in refusing to get vaccinated?
Yeah, I think the declaration provides that people who do not meet the requirements on the stated deadline, they were supposed to be to take leave and use their leave until they meet the requirements. And so I believe that's what's happening in terms of anybody who has, or any employee who has been permanently terminated for not complying with the requirement. I don't have that report at this point.
Thank you very much.
Thank you, Joey. Okay, are there any other questions? If not, we will move on to our next.
We're fine at Samoa News. Thank you so much, sir.
Okay, and then one other point to Philly's great question about the quarantining of our travelers from Hawaii. There's also a concern about focusing and shifting our personnel to where it's really needed. And at this point, we need to have our health personnel available to the community to deliver the vaccination to our homebound population and to our elderly, and also to test and treat them. So that's all part of the calculation that went into the task force thinking to move our resources from supervising quarantine of our folks and to focus on the community, since the virus is already in the community. Ya, ole watato wo mai le fai unga o le tato mafutanga i le nei tae au, moli atu le nganga whaftai lo to on sai. Ya, nole tasi le fomai i ona wha umatulola ia i le whionga maputasi.
Talawa lo whionga le Carb o le Chairman. Le o se fisili ngā le Singapore kuanga. Ma le advice il kako kongu. Go longo maybe an hour and a half, the press conference living and various presentations by various agencies, and a very clear introduction by the Lieutenant Governor. The only two things you can pick it from. Or the vaccination. Vaccination. Poli tui puia. O le melon lua, early detection. Le kalong mai uma, kalong ai hoi whima and all that. Kau kua ngama o kou le kungu. A whanonga ko loa, kua maka kau fulu, pe tale, o wa whatali. Tau le whail tui. Wa le tui na e tau mai ia oe. O wa whaina oe le COVID pele. O lona wenga e mawhai o na pui ai lo soifua. Wa leo e tato vai la aue, tonga fiti ai. Io mea ta ua ngā e lua. O le vanga la lea wa whaina wa positive. Be mindful of others, man. Io lo vela tua oi. Ai lo vole lo wa whaina, tau vele le. So ese ma lo a inga, ma lo whanau, o wo, a me se le lotu. O le mea moli. Le atuno e. Tato whamasani, e ola COVID. This virus is not going to go away. It's not going to go away very soon. It's going to be here for a long time. We just have to live with it. Learn how to live with this virus. Kira karale, alisi ko inga longa kali, sali, ko ola. Live smart. Ne pau mas fa kwanga. Fianga luke ngowang. Le ko.
Ya, whaftai lau fianga li fo mai mo fautuanga matango fie. Ya wa foile sila fie le tato atunu. Temi nei. Malo mik Samoa o le atu lola noa i le tamao le tunu, i le whionga i le maputasi. Ia mo sana whautuanga foi, wa o se apopoinga, ia wale ma malu o le tātou atunu.
Whakai aku i leo whionga, ale, nika ia lukian kovanga, me foi whio aku le whionga lo ia siri. Le foi i le sui, le whionga ia hui whakari, le whio aku le whionga mutua ia pulu, le whomai, ia samanga, ia ma ulanga o kako ngaluenga ngai kai au o le kako kongu le o mo mai le nganga ka fai ako le fionga le karma ulanga le nei task force ang fai fo lo ie fa mangingo ulanga o kako ko le o kako yai ya ele mo fai e ma ko ngai mo fo mai ngai a fai se mea a ngavo au mai el kako kongu ya ka ko ngā ruenga e whai whakas. Kasi al sa kuila mangoa. Mea le kang whea kuai. I le upu le wha self-responsibility pe ia kang mawhaia e a oe ia. I pui I kulanga o oe i anga li liulo. Mai le pui nga oe a oe. I whaingolo kui, whaingolo pusta, chest, whaimalo mask, whaimalo kulanga le, vala. Ala whai ka whainga molo a inga. Molo whangau, molo ngu, molo kaere sia, molo wakungu. E le skulanga la wa pe e whai ko kasi se vaenga ma le vaenga le o kako uma. Kasi ale sa le e kui mangua. A kako uma le kongo sa le. Ia te nganga ka whai koe i la ua man ngai. Whafkai aku. Leo ko i lo inga so swangi mai fo malo kele i le vaenga le fima ia mese fo ia. O mai e o mai. Ia kako ngā lue whakas. Ngā lue whakas. Ole, kuila mangua. Awange e make le upo le kua. O le upo i ange il fai mua. Fai mai. O e o whakua ia ke ia. O ave ia le manga. Ave ia le manga. Ka waila ko o le whangau a le kua. E whapalangi. And as many as believe in him, he gave them the power and the right to be called the sons and daughter of God. O le pāwalanga, le whai mai fwoi ki mo keo, e rua, fwoi kasi mal fiku. Whai mai ki, e le waku le kua se ngango se whewhe, le waku le kua o longa lofa, ma longa manga, ma le mawhau kakau. God has not given us a spirit of fear, but of power and of love and a sound mind. Ngā whola me mawhawhau. Le lawe kang ia kong whau kuako. Kang ia kako kako lima, whain kako whaia. Ai le mwhai a sesi vaenga mlei vaenga. Mga o mia kako ngā lue whakasi. O le kausanga pe aku, le ako nguu. E mga o mia so swangi, silsila. Le u kan ngaku fo mai ia. Le kai fo ia mo tsa ml vaenga public health. Ya, talipanga. E ma tatu le tua, ma la kou, umo el whalmai. Silfia, e le malo lo ko kere o la kou. Leo sa vali le lua ko sanga, ma le kolu masinga. O kere o la kou ia mo meu frontline workers, first responders. Ia a ka kou kako ngofu, kako whale mo kako. Maka kako TV mwe. Ia ko kere o la kou le o mo se malo lo. Kara mo ia. Ele o mo se malo lo. Le merenga. Ayo yaku ya kio. O Samoa. Nei, ko fa longo le kala fai so lo ke ko vanga e mga ko uma. E ka ko hola ia i ka ko kuma. O lo vai mai o lo vai ya. O lo si mai o lo si ya. O lo fa lo mai o lo fa lo. O lo fa mai o lo fa. Ele me fai. A ve senga langa o mea. Whaku ko ngā la langa ka ko a mai anga mua. Ka ko iloa. O ka ko iloa. E mua le kua. Mua le kua. E mwhain ka ko whaia be uku. Ka ko ngāla maka. Ia se ka mwhai aku ngā e ngai uli i e manguia kulanga. O le ngai task force whia ko le whionga luken kovanga. Ia me fui le whionga loia sili. Ia. Tau uma ngai kongo le task force. Afka yaku kulanga uma o le wha moe mai mese foi le fima ia mese foi le fionga ia ufa kali ma ko sa malanga mai fa ia mo le yaku fa ka kele Amerika ia mo we ko kwasu tai
tonu o i una o tato fatasinga i le nei tai au Amerika Samoa ia o fautuanga na ma sta mo fainga foi ala fainga malo ia walo tato fianga iai mal fa mai o le COVID suluiva manu te le ina o faive le nei aso mal vai aso atoa se temi foi o iluma ia o le amato toi o mai foi ia e matu atu nisi fa matalanga ia wal tau mo fainga la fainga malo e ia fatasi le tua ma ia manuia Amerika Samoa ilona lofa soifua